Good morning and welcome back to my channel. Now I am discussing few of the questions frequently asked for the radiographers exam. So it will be helpful for all the radiographers who are preparing for the exam. So please do watch all the sessions and do support me.
Welcome back to the Part 7 exam coaching for radiographers. In the previous sessions, I have already discussed 65 questions. Today, I will be discussing the remaining questions frequently asked for the radiographers exam. Question number 66. AERB prescribed room dimension for X-ray unit. AERB is Atomic Energy Regulatory Board. Option A 10 meters square, option B 25 meters square, option C 18 meters square and option D none of these. The answer is option C 18 meters square. ARB General Guidelines Room Size. The room housing an X-ray unit shall be not less than 18 meters square for general purpose radiography and conventional fluoroscopic equipment, and the size of the room housing the gantry of a CT unit shall not be less than 25 meters square. Question number 67. Half-life of radon. Option A 3.12 days. Option B 3.33 days. Option C 3.83 days. And option D none of the above. The answer is option C 3.83 days. Radium-226 decay by alpha particle emission directly to radon, which is a short life, which is having a half-life of 3.82 days. Question number 68. The recommended total filtration for a diagnostic unit of greater than 70 kVp is, kVp means kilovolt peak. Option A 2.5 mm aluminium, option B 1.5 mm aluminium, option C 4.4 mm aluminium and option D 0.5 mm aluminium. The answer is option A 2.5 mm aluminium. Total filtration is a combined effect of inherent and added filtration, stating that total filtration of 2.5 mm of aluminium is required for X-ray tubes operating above 70 kVp kilovolt peak, and the role of filters is to shape the X-ray beam and to absorb the low energy photons in order to reduce the skin dose skin dose. It is a role of filters in radiology. Question number 69. What is not done by grids? Option A. Remove scatter radiation. Option B. Increases patient radiation. Option C. Produce film with better contrast. And option D. Decrease patient dose. The answer is option D. Decrease patient radiation. The primary function of anti-scatter grids is to absorb scatter radiation emitted by body tissues before reaching the film or imaging plate in order to increase image contrast and detail. Generally, grid use is recommended when the anatomy to be X-rayed exceeds 12 cm in thickness or if exposure settings exceeds 70 kVp. So, the role of filters is to reduce or to remove the scatter radiation as well as to improve or increase the image contrast in detail. Question number 70. Micro air bubbles are used as contrast in option A MRI, Option B, ultrasound. Option C, CT scan. And option D, DSA. DSA is digital subtraction angiography. The answer is B, ultrasound. Micro air bubbles are used in medical diagnostics as a contrast agent for ultrasound imaging. Abdominal contrast enhanced ultrasound, also called CEUS, is an ultrasound examination that uses gas-filled air bubble to better visualize organ and blood vessels within the abdomen and pelvis, including the liver, spleen, kidney, pancreas, bowel, and bladder. Question number 71. In T1 weighted image, parameters are option A, short TR and short TE. TR means repetition time and TE is the time to echo or echo time. So both will be short, short TR and short TE. Option B, short TR and long TE. Option C, long TE and long TR. And option D is long TR and short TE. The answer is option A, short TR and short TE. TR is the repetition time, repetition of the RF pulse, and TE is the echo time. When the pulse sequence stops, the echoes is produced, and that echo producing time is known as the echo time. T1 weighted images are produced by using short TE and short TR times. The contrast and brightness of an image are predominantly determined by T1 properties of tissue. Conversely, T2 weighted images are produced by using long TE and long TR times, and the CSF is dark on a T1 weighted image and bright on a T2 weighted image. I am showing some MR images. So this is a T1 weighted image, and here in this image you can see the lateral ventricle. As you all know, the lateral ventricle is formed of CSF fluid, and simply by seeing this image you can identify that the lateral ventricle, once the CSF is dark, then it will be a T1 weighted image. By simply seeing we can identify, or we can identify by using the TE and the TR value. So in the case of a T1 weighted image, the TE and the TR will be short. So it will be roughly around 15 to 25. TE will be roughly around 15 to 25 and TR will be around 400 to 600. I am doing some comparison with another image, same brain image. So here you can see that the lateral ventricle is bright. Since the fluid inside the lateral ventricle is CSF and it appears as bright. By simply seeing this image, you can identify that this is a T2 weighted MR image. And by seeing the parameters, we can do a comparison. TE is 100 to 200 and TR is 3000 to 4000. So just do a comparison. When the TE and the TR value is short, then it is a T1 weighted image. And when the TE and the TR value are long, then it is a T2 weighted image. Question number 72. If height of lead strips is 2 mm and the distance between the lead strips is 0.25 mm, then what is the grid ratio? Option A, zero point 0.5, option B 8, option C 10 and option D 4. The answer is option B 8. Grid ratio, which is a ratio of the height of the lead strips to the distance between the two strips, that is the interspace. So here the height of the lead strips is 2 mm and the distance between the lead strips is 0.25 mm. So how we will be calculating the grid ratio? Grid ratio is the ratio of the height of the lead strips divided by the distance between the two strips. So the answer is 8. Question number 73. Hip joint is a dash type of joint. Option A, saddle. Option B, hinge. Option C, ball and socket. And option D, gliding. The answer is C, ball and socket. Hip joint is a ball and socket joint which allows motion and gives stability needed to bear the body weight. The socket area is the acetabulum is inside the pelvis and the ball part of the joint is the top of the thigh bone femur. It joins with the acetabulum to form the hip joint. And another example for a ball and socket joint is the shoulder joint. Question number 74. The CT artifacts produced due to the heterogeneous X-ray beam are called option A, motion artifact, option B, beam hardening artifact, option C, streak artifact, and option D, ring artifact. The answer is option B, beam hardening artifacts. Beam hardening is a phenomena that occurs when an X-ray beam comprised of polychromatic energies passes through an object, resulting in selective attenuation of the low energy photons, which changes the CT value of the tissue. To know more about the CT value as well as the CT number, you may refer my CT components of CT or generation of CT numbers. I have already discussed all those sessions, so kindly go through that. Here this motion artifact arises by the motion by the patient. Streak artifacts will arise by some metal implants or by metallic substances, and the ring artifacts usually arises by the miscalibration of detectors. Question number 75. The technology used in DR, digital radiography, are all except option A, photo-stimulated phosphor-based system. Option B, charge-coupled device. Option C, FPD, amorphous silicon-based. And option D, FPD, amorphous selenium-based. The answer is option A, photo-stimulated phosphor-based system. Digital radiography (DR) is an advanced X-ray modality which produces a digital radiographic image instantly on a computer. Compared to other imaging devices, flat panel detectors, also known as the digital detected arrays, provide high quality digital images. Thank you so much for your patient listening. Hope you all understood all the question and answers I have discussed today. If you have any queries, you can just mail me, and my mail address is parvathythejus1609@gmail.com. So once again, thank you so much, and if you like my channel, don't forget to subscribe and share with your friends, colleagues, and everyone who are preparing for the exam. So once again, thank you so much.